The Ministry of Health announced today that there are 3 febrile illnesses in circulation in the community at the moment. These are the Covid-19 virus, dengue and the typical viral infection. Health authorities today urged the public to be mindful of their symptoms if they get sick and advised on what the procedure should be for such patients. This is because underestimating the symptoms brought on by any one of the diseases, especially COVID and dengue, could have dire consequences.
If a person is suffering from fever and if the fever continues beyond 48 hours, definitely you have to get yourself tested for dengue first or simultaneously for the COVID-19. Basically, you should not stay at home without getting tested if you have symptoms and symptoms continue for more than 48 hours. And also, if you are having mild symptoms and if you don't have the testing facilities at hand, still it is better and we highly recommend that you should stay at home and get yourself isolated from the weak family members, because we do not know, it could be mild COVID-19 Omicron illness or it could be any other illness. But if you expect in the worst scenario, we need to make sure that we are not going to spread this disease to the immediate family members who are weak.
Nevertheless, a majority of deaths taking place in the country right now is the doing of the COVID-19 virus. Last evening, 36 COVID-related fatalities were confirmed, and in the past week, the daily deaths have been between 20 and 40. This figure once stood between 10 to 20. Similarly, the country's daily COVID cases are also on the rise.
We cannot 100% say whether all these cases are Omicron or not, but there are considerable number of patients who have been struggling in ICUs and dying late after 2-3 weeks. So therefore, still there will be at least some proportion of Delta infected persons also among these deaths. Whatever, whether it is Delta or Omicron, the likelihood of death is depending on your level of immunity, which is inherent to your body and depending on your age and the other comorbidities that you all are having, and also the treatment that you are taking. To improve your immunity, there is no other way other than getting the required vaccine.
In the meantime, a study conducted by the University of California, Irvine suggests that antihistamine medication could possibly reduce the effects of symptoms from long COVID. Following a COVID infection, some people develop symptoms such as brain fog, joint pains and fatigue that last for 6 months or sometimes even longer. As such, researchers stated that antihistamine medication that could be brought over the counter are able to revive long COVID patients back to 90% of their pre-COVID status. However, the researchers urge the people to not resort to buying antihistamines without professional medical guidance.